Welcome to YourForState.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Of course, he's our specialist on foot and ankle conditions. Nice to see you again, Dr. Michaels.
Thank you, Angie.
Now, our question for you today is, what are fungal toenails?
Well, fungal toenails basically are thickening of the toenails. It's a condition where fungus invades the toenail, begins to grow, and causes the toenail to get very thick and yellow and brittle, and it can be somewhat painful. If left untreated, it can spread to other toenails and even fingernails. And as they get thicker, they can cause the toenails can cause pressure on the toes and create an ulcer, which leads to an infection and possible amputation if in the most severe cases.
All right, so tell us how we treat this.
Well, it's treated four main ways. Now these ways are based on evidence that actually works. There's a lot of anecdotal treatments for toenail fungus. The first way to treat toenail fungus would be a pill. There is a pill called Lamisil, and there are other medications like this, but this is the most common type used today. With this, you take it once a day for 3 months. It stays in your system for up to a year, and it continues to work even after you stop taking it. However, the side effects could be liver damage or liver failure. So we have to do blood tests to make sure the liver is okay when you take this medication. That's the downside to it. The next way to treat it is topically. Now, there's a lot of topical treatments out there. Most don't work, but we found one that does. We use this at our institute quite a lot for this condition, and it's called Teniacide. It comes with a shoe spray to kill the fungus inside your shoe. It also comes with a cream that you put on your toenails, and you put it on twice a day, and we've found that this works better than anything, and there's no side effects. The next way to treat it is surgical removal of the toenail, so you don't have a toenail anymore. Now, this is a good option for people who are older, who have arthritis and can't reach their toenails. It's not an option for everybody, but it does work very well, and when you don't have a toenail, you can barely even tell because there's a hard keratin or a hard material that forms in place of the toenail, so it doesn't look that bad. And then finally, doing nothing, it spreads, gets worse, and leads to the complications before. So those are really the four main ways to treat it. I prefer to go topically at first. If that doesn't work, you can go ahead and take an oral antifungal medication. We do the blood test to make sure you're safe, and that usually takes care of the problem.
All right, thanks so much. Once again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your questions about foot and ankle conditions only here on YourForState.com. Welcome to YourForState.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Of course, he's our specialist on foot and ankle conditions. Nice to see you, Dr. Michaels.
Nice to see you. Thank you.
Now, our question for you today is, what are ingrown toenails?
Well, ingrown toenails are basically a condition when your toenail grows into your skin. It creates a foreign object effect, basically, and your skin tries to attack the toenail that's ingrown into it, creating an infection.
All right, so tell us how we go about treating this.
Well, since it's so common, we're avoiding tight-fitting shoes, avoiding trauma to the toenails are really the two main things that cause it. And to treat it, sometimes just changing the shoes can help. However, sometimes that doesn't work and you have to have treatment. Oftentimes, doctors will prescribe antibiotics, which really does nothing for the condition because the problem is the toenail is growing into the skin. Trauma can cause this. There's a root to the toenail, and wherever you have a root, you have a toenail growing out from that root. Now, trauma can affect where the root is located by squishing it basically from the center to the side of the toe. Now, if you have root on the side of the toe, you're going to have toenail growing out there too, so it curves in and cuts into the skin. This can be easily fixed, not really with antibiotics, but with a small procedure done in the office where the toe is completely numbed. That part doesn't really hurt that bad, and after that part's done, you don't feel anything. So it's a pain-free procedure from there on. You remove basically a small sliver of toenail on the side of the toe, and afterwards, which this process takes about 5 minutes, afterwards, there is a special soap that we would provide. It's called Hibiclens. You wash your foot with this once a day, and there's a special dressing that we have you put on. It's like a Band-Aid, and you put that on once a day, and after about 2 weeks, you're healed, the infection is gone, and you're back to your feet. The nice thing about it is you can walk out of the clinic with your shoes on, and so there's really no period of non-weight bearing after this procedure, which only takes about 5 minutes and is very minor to do.
All right, thanks so much. Once again, Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your questions about foot and ankle conditions only here on YourForState.com. Welcome to YourFirstAid.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Of course, he's our specialist on foot and ankle conditions. Nice to see you, Dr. Michaels.
Nice to see you again. Thank you.
Now, our first question for you is, what are plantar warts?
Well, plantar warts are an infection of the foot or the skin by a virus. The virus usually likes small children. It can affect adults as well, but it's a virus, and it's a human papillomavirus. And this is a different type virus that does not cause cervical cancer, but it causes actually plantar warts. There's no crossover, and it causes a keratin or a callus with black dots in the middle of it to form on parts of the foot, usually on the bottom of the foot.
All right, tell us how we treat this.
Well, plantar warts are treated various ways. There are lasers that can be used, surgery can be used, there's medications, and there's chemicals that can be used. The first line in treatment of these is to really avoid the areas where you would contract this type of virus, and that would be showers, public areas, places where you go barefoot in wet areas around other children. Now, if you could wear flip-flops or wear something to cover your feet in these areas, you'll avoid getting the warts most likely. Now, if you do get one of these, you need to seek medical attention for it because it can spread, it can stay there for up to 2 years, it can cause pain, debilitating pain, or it can just be annoying and not look very good. The ways to treat it, first we would try to put a chemical on the wart, which would cause the body to attack the wart. The chemical does really nothing if you don't have an immune system. It actually stimulates your immune system to attack the wart. And usually that works. It's simply put on with a Q-tip, it's painless, and then we put a Band-Aid on, and you have to keep the Band-Aid on and dry for 24 hours after you put it on. Now, some people have tried freezing the wart, and that doesn't work very well in the foot because the skin on the foot is so thick, the freezing doesn't get down deep enough. So the chemical actually works by tricking the body into doing what it should do. There's really no side effects of the chemical. It doesn't hurt at all to put it on. You can have some discomfort after a couple days. Now, after 1 to 3 applications of the chemical, because it doesn't always work the first time, however, it usually does, we can proceed to doing a laser removal of the wart. And we use a laser because it's less painful. That completely eliminates the area of the wart, prevents bleeding and infection, and postoperative pain. With all of these procedures, you can walk the same day, the next day. There's no period of non-weight bearing. It's a quick procedure either way that can be done in the office. It takes 2 or 3 minutes, and it's a very minor complication rate with that. So that usually takes care of it, but the mainstay for treating the warts of freezing them really doesn't work on the foot because the skin is too thick. So I think these conditions can best be treated in the office by a professional using minor surgical procedures.
All right, thanks so much. Once again, Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your questions about foot and ankle conditions only here on YourFirstAid.com. Welcome to YourFirstAid.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Now, nice to have you, Dr. Michaels.
Thank you, Angelique.
Our first question for you is, what is tarsal tunnel syndrome?
Well, tarsal tunnel syndrome is when a nerve in the foot gets pinched. The nerve in the foot traveling behind the ankle oftentimes gets pinched in this area because there are certain fascial bands that cover this. And as time goes on, as people age, these bands can get tight and pinch the nerve and cause heel pain and numbness in the toes. It's a similar condition to the carpal tunnel syndrome you often hear about in the wrist.
All right, now tell us, how do you treat tarsal tunnel syndrome?
Well, with any problem, there's conservative and surgical treatment. Unfortunately, with this condition, surgical treatment is usually the treatment of choice. However, if someone has a problem with getting time off work for the surgery, we can treat it conservatively temporarily by utilizing orthopedic shoes or orthotics, which are custom devices that help support the arch, and they can realign and take pressure off the nerve that's being pinched. But that's only a temporary measure usually. Sometimes pills can work. Certain medications that are non-narcotic can help take away some of the nerve pain as well. But nothing really decreases the pressure on the nerve from these fascial structures. What has to happen is a surgery which requires no overnight stay in the hospital. It's same day. It takes about 30 minutes. And you basically have a small 2-inch incision on the inside part of your ankle. The nerves are released from those tight structures. The nerves are not cut. It's just the structures on top of the nerves that are released. And then the skin is sewn back up, and basically you walk on this after about 3 weeks. So you do have to stay off your foot with crutches and a special walking boot for a few weeks to let the skin heal. Now, nerves grow back after the pressure has been released. They grow back at about 1 inch a month. So from the ankle down to the big toe, that's the distance that the nerve has to grow, which could take 8, 9, 10 inches, which is 8, 9, 10 months to recover. But during this time, you're walking and you're getting along, you're doing everything you have to do normally in your active life, but you just really have to stay off your feet after the surgery for about 2 to 3 weeks. Beyond that, those are really the 2 main ways to treat it, conservatively and then finally surgically to release the nerve.
All right, thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can ask your questions on foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thank you, Angelique.
Well, our question for you is, what is Achilles tendonitis?
Well, the Achilles tendon is a tendon that attaches to the back of the heel. It's the strongest tendon in the body, and it sometimes gets inflamed, it can become damaged, and it can rupture. So this is a real problem because it is paramount to have an intact Achilles tendon for normal gait.
All right, now how do you treat Achilles tendonitis?
Well, we see this problem in multiple patient populations. Children, for example, who play soccer get this in a way. It's called Sever's disease, and it's inflammation of the back of the heel. You can see where the Achilles tendon attaches to the back of the heel in the middle of this. And for example, with children, as I talked about just previously, this area can get inflamed, and simply taking some time off and resting for a while to allow the area to calm down can help take that away. Additionally, utilizing a felt heel lift. This is a 1/4 inch thick, and placing it underneath the heel in the shoe can take away some of the discomfort. There are stretching exercises that can be utilized, and there are also orthotic devices that can be utilized. Now, for example, in the adult, let's say someone plays tennis, they overdo it one weekend and they get inflammation in this area. It can lead to, if unchecked, rupture, because the inflammation causes damage to the tendon over time, and there is an area proximal or 2 inches above where it attaches to the heel that oftentimes this tendon ruptures. By simply stretching out the tendon pre-exercise, utilizing a heel lift or a custom orthotic device, can take away some of the pain. Now, if a tendon does rupture, sometimes surgery is indicated, but for 98% of patients with this problem in the back of the heel, oftentimes no surgery is needed, simply utilizing an orthotic or a heel lift or immobilization in a cam walker, and I have one of those here. It's a fairly large boot that is Velcro attached to the leg, and simply by utilizing this, it can take away a lot of the discomfort in the back for a period of about a week is all really that is needed for immobilization of this. And you can walk in this during that week. So conservative treatment for Achilles tendinopathy or tendonitis is really the mainstay of treatment. However, sometimes surgery is needed, and that is a fairly minor procedure, but it is discussed mainly with your doctor at that time if you do need that.
All right, thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can ask your questions about foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thank you very much.
Our question for you today is, what is flat foot?
Well, flat foot is a very common condition for most people, and it's really not a problem unless it hurts. But if you look at the skeleton of the foot, there's a normal arch underneath here. And if you have a flat foot, you can see how that can change. And basically, it's just the bottom of your foot is very flat. There are lots of different medical names for this, and I won't go into those right now, but flat foot should suffice for this discussion.
All right, great. Now tell us, how do you treat flat foot?
There are conservative and surgical means to treat this condition. Now, it depends on the severity. There's a very complicated grading scale for this. There's 4 levels to it. And the basic main level is level 1 and going all the way to 4. Conservative treatment mainly for this consists of wearing proper shoe gear. For example, if you go barefoot or wear flip-flops, you're not getting any support. So wearing a good orthopedic shoe or a good tennis shoe with support for the back of the heel as well as arch support on the bottom may help. Now, if the problem is a little worse, a custom orthotic device like this can be beneficial. This goes underneath the arch and supports the arch. Now the problem is, oftentimes with the structures on the inside of the arch, they stretch out, and if they stretch out, then the foot can flatten. So supporting this can help. Now, if the condition is worse and requires more than just an orthotic device, a simple brace that goes up around the ankle can be very beneficial. It supports the arch, but it attaches to the leg as well, and this provides the maximum amount of support for this condition. Now finally, if the problem becomes really severe and none of these things help take away the pain, then surgery is indicated. Now there are lots of different types of surgeries for this condition, and you would have to talk to your doctor at the time that you're having pain with this to determine what would be best for you. Oftentimes though, it does require some bone cutting, and there may be time such as 6 to 8 weeks off your foot with this condition. However, there are other types of surgeries that can be done that aren't so severe, and it requires simply 2 to 3 weeks off. So it depends on the severity and the pain that you're having and what has to be done to your foot. But we try to treat this conservatively first, and usually about 90-95% of people respond to conservative treatment and they don't have to have surgery.
All right, great. Thanks so much, Dr. Dan Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can ask your questions on foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Johnny Motrin from the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you here, doctor.
Thank you.
Our question for you is, what is Morton's neuroma?
A neuroma is a painful condition of the foot, also referred to as a pinched nerve or nerve tumor. It is a benign growth of nerve tissue that is often found between the 3rd and 4th toes, but can also occur between any of the digits. It usually runs between the metatarsals here. It brings on pain, a burning sensation, tingling, cramping, or numbness between the toes and into the ball of the foot. The principal symptom associated with a neuroma is pain between the toes while walking. Those suffering from the condition often find relief by stopping their walk, taking off their shoe, and rubbing the affected area. The patient will often describe the pain as similar to having a stone in his or her shoe. The vast majority of people who develop neuromas are women, also very common among runners. That being said, the exact cause of this condition is unclear. There are a number of different factors that can cause a neuroma. Biomechanical deformities such as a high arched foot or a flat foot can cause instability around the toe joints, which can lead to the formation of a neuroma. Trauma can cause damage to the nerve, resulting in inflammation or swelling of the nerve. Improper footwear causes the toes to be squeezed together and can be problematic. Avoiding high-heeled shoes is very important. Anything higher than 2 inches. Shoes at this height can increase pressure on the forefoot area. Repeated stress, which is common to many occupations, can create or aggravate a neuroma.
All right, now how would you treat Morton's neuroma?
Well, conservative care for a neuroma would include shoe gear modifications, wearing shoes with plenty of room for the toes to move, avoiding pointy shoes, and wearing low heels. Resting the foot and massaging the affected area can temporarily alleviate neuroma pain. For a simple neuroma, wearing good supportive wider shoes may be adequate treatment to relieve symptoms. For more severe cases, treatment by a podiatrist may be needed. At the Reconstructive Foot and Ankle Institute, treatment for neuroma would initially involve taping of the affected foot, which changes abnormal foot function and can relieve symptoms. Custom-made orthotic devices are functional shoe inserts that are prescribed at our institute, which control foot function and can reduce symptoms and prevent worsening of the condition. These orthotics also control the mechanics of the forefoot. Anti-inflammatories can ease the pain and inflammation. Alcohol-sclerosing injections are also utilized often, and these are very effective to get rid of the pain. The injections are given over a series of usually 6 to 10 injections and desensitizes the nerve, in essence destroys the nerve to get rid of the pain. This is 90 to 95% successful. In cases that do not respond to conservative measures, surgery may be necessary to remove the inflamed and enlarged nerve.
Thanks so much, Dr. Motran. Again, that was Dr. Motran of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your specialist questions on foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Johnny Motran from the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you here, doctor.
Thank you, Angelique.
Our question for you is, what is athlete's foot and how do you get it?
Well, athlete's foot is a skin disease caused by fungus, usually starting between the toes and can progress to the rest of the foot. The fungus most commonly attacks the feet because shoes create a warm, dark, and humid environment which encourages fungal growth. The warmth and dampness of areas around swimming pools, showers, and locker rooms are also breeding grounds for fungi. Because the infection was common among athletes who used these facilities frequently, the term athlete's foot became popular. Symptoms can vary, but usually include dry skin, itching, scaling, inflammation, which can progress to blisters and cracking of the skin. This can cause pain and swelling. The itching and burning may increase as the infection spreads. In severe cases, a bacterial superinfection may actually occur on top of the fungal infection and complicates the situation. Athlete's foot may spread to the soles of the feet and to the toenails. It can spread to other parts of the body, notably the groin and underarms, by those who scratch the infection and then touch themselves elsewhere. The organisms causing athlete's foot may persist for long periods. Consequently, the infection may be spread by contaminated bed sheets or clothing to other parts of the body.
Now, what is the treatment for athlete's foot?
I'm going to first talk about prevention of athlete's foot. This is not easy since it is usually contracted in dressing rooms, showers, and swimming pools, around swimming pools, where bare feet comes into contact with the fungus. Prevention focuses on practicing good foot hygiene, which would include daily washing of the feet with the soap and water, drying carefully, especially between the toes, and changing shoes and socks regularly to decrease the moisture. Use of a quality foot powder will also help keep the feet dry. When coming into contact with these areas, avoid walking barefoot, use shower shoes when possible, wear light and airy shoes on a regular basis, which will also help prevent the infection. Use synthetic socks that wick away moisture and avoid cotton socks that tend to absorb moisture. Treatment at the Reconstructive Foot and Ankle Institute would include a topical antifungal cream for simple to moderate cases. This is called 1% tolnaphtate cream and is used twice daily until the infection resolves, usually in about 2 weeks. In more severe cases, an oral antifungal medication will be prescribed for a determined length of time. If there is suspicion of a bacterial superinfection, a broad-spectrum antibiotic would also be prescribed.
All right, thanks so much again, Dr. Motran of the Reconstructive Foot and Ankle Institute. And don't forget, you can ask your specialist questions on foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Johnny Motran from the Reconstructive Foot and Ankle Institute. He's our specialist on foot and ankle conditions. Nice to have you here, doctor.
Thank you.
Our question is, what is tendinitis and how does it occur?
Well, a tendon is a tough yet flexible band of fibrous tissue that connects your muscles to the bones and transmits the force of the muscle contraction to the bone. Tendinitis occurs as the tendons become inflamed for a variety of reasons. If the normal smooth gliding motion of your tendon is impaired, the tendon will become inflamed. Fibers will start to tear and movement will become painful. This is called tendinitis and literally means inflammation of the tendon. One of the most common seen in the foot and ankle is Achilles tendinitis. It is a painful and often debilitating inflammation of the Achilles tendon. The Achilles tendon is the largest and strongest tendon in the body. It is located in the back of the lower leg and attaches to the heel bone, connecting the leg muscles to the foot. Achilles tendinitis can make walking almost impossible. Symptoms can include pain, stiffness, or soreness within the tendon and may occur anywhere along the tendon's path. Often pain appears upon arising in the morning or after periods of rest. It then improves somewhat with motion, but later worsens with increased activity. Tenderness or intense pain can be seen when the sides of the tendon are squeezed. Causes can include overuse, usually caused by a sudden increase of a repetitive activity involving the Achilles tendon. Athletes are at very high risk, laborers and weekend warriors, those who are less conditioned and participate in athletics infrequently.
All right, now how do you treat tendinitis?
Well, treatment would initially involve rest or immobilization with the use of a cast or immovable walking boot to reduce forces through the Achilles tendon to promote healing. At our institute, a 1/4-inch foam heel lift is provided to take stress off of the Achilles tendon. Use of ice is also encouraged to reduce swelling due to inflammation. Anti-inflammatory medications such as ibuprofen may be helpful in reducing the pain and inflammation. In the early stage of the condition, after the inflammation has reduced, stretching is encouraged. At our institute, we use something called a night splint, which is this device here. It is very effective. It provides a continuous stretch to the Achilles tendon and prevents the problem from recurring. Also, it is used an air heel device. This is often prescribed, and it relieves pressure in the Achilles tendon. Physical therapy may also be prescribed to include strengthening and stretching of the calf muscles, massage and mobilization, as well as ultrasound therapy.
All right, thanks so much again, Dr. Motran. Again, that was Dr. Motran of the Reconstructive Foot and Ankle Institute. Don't forget, you can ask your specialist questions on foot and ankle conditions only here on your4state.com. Welcome to your4state.com's Medical Corner. I'm Angelique Gonzalez. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you here, Dr. Michaels.
Thank you, Angie.
Our question for you is, what is metatarsalgia?
Well, metatarsalgia is a term that describes forefoot pain. There are a lot of structures in the forefoot, and if you look at the foot, there are 5 metatarsals, and anytime you have pain in the forefoot, it could be caused by something called metatarsalgia. However, that's a very general term. Oftentimes, it can be caused by pain or inflammation of one of the structures in this area. If you look underneath the big toe, there are 2 little sesamoid bones, and everybody has these. And their purpose is to distribute force along the big toe, as that toe takes the majority of the pressure in the forefoot. However, sometimes these bones can fracture or they can become inflamed. Now, if you look at the second metatarsal, there are tendons underneath the bottom of each one of these toes. And the second is interesting in that the bone is very flat on the bottom and it compresses the tendon. So if there's any change in length or position of that bone, the second metatarsal, then that tendon can become inflamed and that tissue can become very painful. Conversely, there are things that can occur in between the bones, such as nerves becoming inflamed, and those are neuromas. However, sometimes when one cannot differentiate the exact cause of the forefoot pain, and it can be somewhat diffuse, metatarsalgia is a term used to describe that condition. Oftentimes, however, there is a structure that can be identified that is inflamed or pathologic in some way that is causing that pain, and treatment can be dealt to that specific object independently, and the problem can be resolved with conservative treatments, usually in the office.
Now, you just mentioned treatments. How is metatarsalgia treated?
It depends on what actually which structure is actually causing the problem for the patient. Oftentimes, however, an orthotic device can be beneficial for the patient. This is a custom-made orthotic device which is designed to take the pressure off the forefoot or the area that's causing pain for the patient. For example,